A nursing home in Tioga County is suffering an outbreak of COVID-19 cases. Elderwood at Waverly is reporting multiple residents and staff members have tested positive for the coronavirus. A spokesman for Elderwood released a statement saying that the residents are currently in isolation and that the facility is following strict infection control processes to limit further risk of transmission. All residents are being monitored and staff screened prior to each shift. There have been no deaths. Tompkins County has reported its first death from coronavirus. Cayuga Health System reported that one of two patients from New York City who were transferred to Cayuga Medical Center in Ithaca has died. Cayuga Health says its medical personnel remain well prepared and committed to their calling and the commitment to treating patients locally and in New York City. As non-essential businesses remain closed and New Yorkers continue to stay home, many people are wondering when things will start to reopen. News Channel 34's Karina Capabianca has more on what Governor Cuomo says it will heavily rely upon.
The governor says it will largely rely on testing, and he's pushing for more rapid testing for the coronavirus. The state is also working to develop an antibody test.
The key to reopening is going to be testing. I've said that from day one. It's not going to be a light switch where you flip this economy like you flip a light switch.
Governor Cuomo says that when non-essential businesses do reopen their doors, it will be a gradual, phased process. He says the rate of testing we're at now is still not enough to reopen on a meaningful scale, and that the federal government should act through the Defense Production Act.
We need an unprecedented mobilization where government can produce these tests in the millions.
He says he doesn't believe that private companies on their own will be able to come to scale quickly. The State Department of Health is also in the process of developing an antibody test that would show who has already had the virus and recovered.
Right now, the State Department of Health can do 300 tests a day. By next Friday, they'll be able to do 1,000 tests, 2,000 tests the following week. That's great. Sounds like a lot, but 2,000 tests are still a drop in the bucket.
Health Commissioner Howard Zucker says it would be like any other blood test.
We're working on a way to do a finger stick or a heel stick, very much like we do newborn screening tests, and use that blood spot as a test.
The governor says he's interested in partnering with both the federal government and neighboring states, New Jersey and Connecticut, to get the testing up. In Albany, Karina Capabianca,